I am joined today by our director of the graduate programs, Bernie Backer, who will be presenting with me on the public health program. For our students who have been admitted and are planning on joining us in spring, we're very excited to welcome you to campus. This session will serve to give you more information about the program as you begin your journey to SLU. For our counselors and all of our N2 teams around the world, do take this information and please share with any future students that you're working with or applicants for future semesters for our excellent program in public health. A little bit about today's session. I'll give a quick overview of St. Louis University, and then we'll dive right into the program, the unique selling points kind of for our students joining us, what to expect. And then we'll tie everything up with any questions and answers with Bernie himself. I will be jumping out about 30-40 minutes into the session. So if there's any questions that remain that are unable to be answered, I'll leave my contact information up at the end. But throughout the presentation, feel free to put any questions in the chat and we'll attend to those at the end of the session. But without further ado, Bernie, quick introduction of you and the program, and we'll get into this.
Hi, thanks for joining us. Yes, thanks, Ryan. I'm Bernie Backer, the Director of Graduate Admissions in the College for Public Health here at St. Louis University. And we're thrilled to have you all here, and we'll be diving into more details momentarily, so I won't do that now.
Yeah, and I just wanted to make one note. Bernie, how long have you been with the public health program here at SLU?
Oh my gosh, long enough to have my picture on the wall of fossils up in DeBerg Hall. I came in 95, so what is that, 27 years?
Yeah, a good history. And, I think it's a great indication for our students joining that, we have a team from your department that are really taking the time to make sure that your journey from this moment before you even arrive is really excellent. So Bernie, thank you. Let's get into this. A quick overview of St. Louis University, kind of what you shall expect from, the experience here at SLU, why SLU is such an excellent destination to study at. Very historic institution. We're founded over 200 years ago. So you and your experience here will be rooted in a very strong history of academic excellence, research intensivity, as well as recognition locally, nationally, and globally from your degree at SLU. So a prestigious institution where you will be working hard, but having a lot of support. I think one thing that's notable about the SLU education is the community environment that we have here. You can see we have dedicated resources to make sure that your beginning of your journey before you even arrive is really well thought out. We have Bernie's time here today, which we're very appreciative of, but all the way through the time that you graduate, your experience here will be really rooted in community for your support to make sure that your academic journey and your career progression is as excellent as you hope it to be. Class size here is a little bit more intimate, so that means a lot of focus on you and your trajectory. We are a urban campus, so you will be surrounded by a medium, larger U.S. city. We'll talk a little bit about why that's really important. Lastly, the university is ranked in the top 3% in the United States, so you will be at a very academically renowned institution as well. So rankings do matter, but we'll get into the program and why that's important as well. So without further ado, let's dive right into the program. More broadly speaking, Bernie, why public health? Why a master's in public health? For students coming into this program, why now?
I think, yeah, that's a great question. So healthcare, as we all know, is getting increasingly more expensive, and it's surrounded by challenges of people being able to access great healthcare and get good quality. There's huge issues to do with health disparities, kinds of issues, equity issues, not just here in the United States, but around the world. There's environmental issues that prevent, people, varies from country to country, how good access they have to even clean water. So there's a lot to be done here, both in the U.S. and abroad. And as we've seen recently with the pandemic, the COVID stuff, there's just tons to do, and we've learned a lot from how we worked with COVID. So there's a lot more to do to improve how we respond in the future too.
Well, and, in addition to the field, kind of the bigger question, why SLU, our College of Public Health and Social Justice, and maybe kind of what makes us a little bit unique in this field, kind of a distinction point from other institutions.
Yeah, great. Yeah. Well, I think you alluded to it when you talked about SLU in general, and that's the close relationships that students have with faculty here. We have very small class sizes. Our core classes at the largest are like 20 students, but once you get into your concentration area classes, those can be anywhere from 6 or 7 students to 10, 12 students. So there's really good interaction there. In fact, I like to joke that, you can't hide because they're going to know you by your first name. So there's that opportunity. The other thing that distinguishes us from some other programs is that the research that our faculty do is mostly community based, and we hire for that in our mission. So in other words, the research going on here in the public health school involves community partners, both locally, regionally, nationally, even internationally. And we'll do a lot to get you involved with our partners. St. Louis in particular has huge health systems headquartered here. In fact, we're #1 in the country for health dollars flowing through health systems here. So there's a lot of our alums working in these organizations. So that means we can bring them to the classrooms where you can work on projects, get great internships. We can utilize them for adjunct faculty. In fact, we're also now providing opportunities for first-year students. When you come in with us in the spring semester of your first year, we can get you into a 2-month-long project if you'd like, working with either our faculty or community partners. So that's a big thing. And then the last thing that I'd mention, or well, 2 more things, and then I'll stop. There's a certification exam. It's not required in this field, a certification in public health, but we actually require it for our students to take that, and we prepare you for that so that if someday public health certification is required, you'll already have it. And so you'll be well prepared for that. The national pass rate on that exam is about 77% on the first time around. Our pass rate's well over 90%. So we're one of the tops in the country in getting students assuring that they pass that exam and they're well equipped for fellowships and jobs in the future that will require that. And then the last thing that I'd mention is that we're one of the older and largest schools of public health in the middle part of the country. So that means besides the great education that you get here, we are very well connected to the practice world and have excellent faculty mentors and student success members on our student success team to help you access those folks for things like internships and jobs. Sorry, that was a lot.
Yeah, community, opportunities, careers, success. I think that's a really great overview. And kind of how we get to that is really through the curriculum and some unique aspects about our curriculum. Can you talk a little bit about what students should be expecting with the curriculum and kind of the design of the overall program?
Sure. That's an ever evolving thing. In fact, we have a pretty large meeting dealing with that tomorrow. But generally speaking, in most of these concentrations, they're 48 credit hours. Students typically take 24 credit hours a year for 2 years to graduate. The first year tends to be more of the core classes that students have to take. There's a core of 24 credit hours that all public health students take, which in a way is a good experience. You'll get that in the first year. So you'll see kind of the multidisciplinary nature of the program. You'll be in classes, involving all these areas that you see on the screen here. But you'll also start to dive into, your concentration area classes. But year 2 is where you see a lot more of that. Year 2 is when you're also eligible to do the required academic internship that we'll talk a little bit more about later. But part of this program experience is to get you experience out in the field. Besides the applied practice public health and context award that I just mentioned a few minutes ago, there's this academic internship that you'll also do. So that's great. And then the other thing that I'd mentioned that's really strong here, you kind of see at the bottom of the screen, these joint concentration areas. A lot of students, particularly international students, would like to see STEM designated programs. The two that are STEM designated, the 2 concentrations that are STEM designated in our program are biostatistics and epidemiology that you see there. However, what we can do is if you're interested in any of these other areas, you can pursue those and do a joint concentration that includes epidemiology, and then they all become STEM Opt3 designated programs. We can do that really efficiently. It only bumps you up from 48 credit hours to 54 credit hours. So you still graduate in just 2 years. It's just 2 additional courses. And the way we're doing that is you're taking those 2 additional courses plus using your electives from the other concentration. There's 3 elective courses to do the other concentration. And that way we can efficiently get you both designations and get you out. And it's, besides making it STEM designated, adding EPI, anytime you have a joint concentration, you're much more marketable in a competitive job market too.
Great. And STEM qualification is really highly unique for an MPH program. So that, it's a further kind of checkbox for the SLU program. Another kind of great highlight really quickly on the curriculum is kind of compared to other MPH programs that are usually a little bit more general in nature, the specificity of our concentrations and the combinability with the joint degrees is something that is very unique. So students do get that groundwork, kind of the baseline of what MPH, but the specificity in a concentration area. So just wanted to make that highlight. But we had talked a little bit earlier about research and the kind of the history of this program. Can you just talk high level, kind of what a student may expect from a research kind of component?
Sure. Yeah. So as I mentioned earlier, we being a Jesuit university where the mantra is kind of 1 foot in the library, 1 foot in the streets, we hire faculty and look for students that want to make change in communities. And so the research that our faculty are doing, you see that statistics up there, almost 60% of our grants involve community partners of some kind, where we're helping them, partners in the community. And when we say community, that's not just limited to St. Louis. That's, St. Louis, regionally around the world, that sort of thing. But the idea here is that we're trying to make a difference in these communities with the research. And as you can see in the bullet list below, we're doing everything from chronic and infectious disease stuff to behavioral health issues to environmental kinds of issues. We're involved in health equity issues, policy issues. So one of the things that will help you do when you come on board here is how to access the faculty. And again, we talked about that. We have a very open door kind of culture here, so we will get you involved with faculty if you want to volunteer to work on their research, that sort of thing. And then the other piece again is that public health and context project that we offer in your first year and the second semester. If you want to get involved with one of our faculty members or their community partners, we'll get you about a 2-month-long project at about 8 to 10 hours a week, and we'll actually give you a $1,200 scholarship for that too, if you want to do that. But that will get you great experience working with our community stakeholders and faculty on some of these research topics, so that in year 2, when you go out looking for your internship or your job, you'll have that great experience on your resume and be able to talk about that in interviews.
Again, career focus. I love that. I love that you're hitting that, because that's exactly what students want to hear. I know you had talked a little bit earlier about the kind of the base 24. Here's a sampling for students to just kind of to start seeing the roadmap that they'll be looking at. And we had talked about the joint degrees. Anything that you want to touch on any of these kind of core courses, Bernie?
Yeah, I'd just like to say that again, in that first year when you're taking most of these, you can start to get to know the different faculty in the different areas, and that's a time when a lot of students want to think about other areas of expertise that they might want to get, like maternal and child health or adding a concentration. And so we have a variety of certificate programs. So during this time, this can be used as kind of a discernment time to think about either changing a concentration or adding a concentration or adding a certificate program, that sort of thing. But basically these 24 courses, this is what gets you ready for your academic internship, so that and during that time also you'll be working with one of our great members of our student success team, Mary Lynn Glenn. She's the professional development and internship director, and you can see in there that that practice experience piece. She's going to be getting to know you really well during the first year. You'll be required to attend a bunch of seminars on the work that she does and how she can help you identify and get access to these good internships around the country. So it's a good process.
Great. And, a little bit about the curriculum for students starting in the graduate pathway, whether a 1 or 2 semester program. You can see here that the pathway program will have students directly into the degree program, in addition to the graduate level English support courses. I believe most of our students are going direct entry, but for those that are going pathway, it really is an integrative model, and then just a kind of quick roadmap on what students may be expecting from timeline. As Bernie had mentioned, for those going through direct entry, the program typically is completed in a 2-year time frame, which is standard for this amount of credit hours. The graduate pathway may extend it one semester or two, but generally in and out in that 2-year and on to your careers. And Bernie, speaking of careers, I always like to highlight some of the really excellent outcomes, but just kind of a high level overview, with this being STEM eligible for biostats and the epidemiology, kind of talk to us a little bit about, career outcomes in the field more generally after graduation.
Sure. Well, first of all, again, as I mentioned earlier, there's that, public health certification exam. So we do a really good job of getting you prepared for and passing that so that you have access to some of the higher level jobs immediately upon graduation. But our placement rate at graduation time is about 95%. So it's really good placement rates there. Students go into all kinds of positions. So it's, a lot of it varies from what concentration you're in, but generally speaking, there's great opportunities in the public sector, in health departments at the federal and national, state, county levels, wide-ranging NGOs and not-for-profit organizations, and then also in the private sector, in health systems and big pharma, the payer side. The really good jobs in the U.S. where a lot of our students are going now, one of the big changes that's going to happen in a lot of your time here is that we're going to be moving away from what they call a fee-for-service reimbursement model, where providers get reimbursed not by the services that they provide, but by the outcomes that they generate. And it's a much better way to do health. So what that means is the hospital CEOs and presidents in the US are going to be hiring going forward lots of public health people that have public health policy and regulatory kind of skills, but more importantly, the analytical skills, the epidemiology and the biostatistical kinds of skills to run these programs. So these health systems are going to have to start developing what they call community benefit programs, where they're reaching out to the communities and doing things like cancer screenings and substance abuse kinds of programs and pediatric health programs, that sort of thing, all designed to promote and prevent people from needing so much care in health systems. So, we're trying to move away from, diabetic amputations to diabetes mitigation and prevention. So this is a great time to get into public health if you want to get into these high-level positions in health systems or in big pharma or in academic research centers. All these kinds of areas are going to need a lot of people with those policy, program development kinds of skills, and then epidemiological and biostatistical, the analytic skills. So it's a great time. And you can see the list there. We're putting people into some of the top health systems around the country, top, pharmaceutical industries, but also, again, going back traditionally to the health departments, places like the CDC, the World Health Organization. These are all going to be open to you with a world-class MPH from a school like ours.
Well, and those excellent outcomes, as you had mentioned earlier, really are kind of rooted in the experience that they're getting kind of at the beginning of the program. Can you talk a little bit about internships? And, I think students are always interested in that, outside of classroom experience, and some highlights there.
Yeah. So the internship is currently it's a 320-hour requirement. That may change. There's a committee kind of looking at that, how to deal with that a little bit better, especially for working professionals. But the idea here is that we don't require you to have experience coming into the program. It's valued if you do have it, and it does make you a better student, but it's not required. Because we're going to get you a great field experience. And I mentioned Mary Lynn Glenn. You'll also have a faculty mentor from your concentration area, and they're going to help you in year one kind of figure out what your interests are and kind of maybe help you understand what the opportunities are out there, what kinds of organizations might be good pathways for you. And you'll actually, we won't just say you have to get this internship, good luck. We're going to be very hands-on with you to help you get into the kind of organization that you want to be in. So you'll be ready for this after your first year. Some students, if they do a local internship, in one of the local organizations here may opt to do it part-time while they're taking classes during their second years. Other students may do, if they go out of St. Louis, might do it full-time during the summer between year one and year two. Some students, quite often international students that aren't as confident in their English skills might wait to do their internship until after their second year, that's second summer. So it's very flexible, and it'll basically be determined by what you want to do, what kind of organization you want to go to, and what their timing needs are, all those kinds of things. But that's what our staff is here to help you navigate.
And it is these internships, it's the staff, it's the community connection that really leans into, as you had mentioned earlier, the outcomes. And, our students really are getting employed. The placement rate is so high. I think those are just such great strengths to our program, and what you and all the faculty, Bernie, are doing to make sure that each and every student is supported. Any notes on kind of outcomes, kind of what you're seeing in addition to, the companies we talked about? For our guests today?
Yeah, I would just say that, in addition to the support that you'll get to do that, we mentioned St. Louis is, we call it Health Central USA, because so many dollars through health, 9% of all the health systems dollars in the US flow through the St. Louis marketplace every year. So that's one in every $11 is in our community in these big health centers like BJC, which is the 13th largest in the country. St. Louis U is affiliated with SSM, and we have a brand new $550 million hospital just built by SSM right 2 blocks away from us. Mercy, all these big systems. You may not be familiar with all these, but these are huge names, and they're here and have either headquarters or large regional offices here. So it's not just us. We'd like to take all the credit for getting students into great jobs and internships and the training that you'll get. That's part of it for sure. But a lot of it's just where we're located and our connectivity to it, because we've been around for so long and our reputation's really good.
Yeah, no, I think that's a great highlight. A lot of our students are coming from around the world, and maybe, their familiarity with the US, they've never visited, and they may have heard of LA or Los Angeles or New York. But to your point, St. Louis is a really excellent destination, both for students generally, livability, cost of living, but in this field, particular healthcare, and the access that students will have to leaders in the field that are known nationally. Kind of in addition to, that, I always like to highlight a couple notes just more broadly about St. Louis. We were recently ranked the #1 best city to launch a career. So when we think about your investment in education, the location also, as Bernie had mentioned, plays directly into this. Our city is a place where people are welcomed. International students are very welcomed here. A lot of companies, local organizations are looking for that diversity in their portfolio of the staffing. So each and every one of you joining SLU will be in a place that is ready to embrace you and where you're coming from and those different viewpoints. Can
I just add that #1 best place in the country for young professionals? That's a LinkedIn from LinkedIn too, by the way. So it's a very credible ranking. And you mentioned affordable. St. Louis is one of the most affordable cities in the country. So in addition to competitive tuition rates, you'll literally save tens of thousands of dollars just in apartment leases compared to living on the east or west coast in the United States, or maybe even Chicago. So it's a very affordable.
Yeah, that's a great point. I always tell students, if you're a student that is seeking a scholarship, which we have excellent scholarships, thinking about cost of living is a really huge factor, because it could be the difference of having to pay multiple thousands of dollars or something more affordable like here. So that's a really excellent point, Bernie. And you can see here as well, our location is very strategic in the large industries, healthcare being one of those. But also, as we had talked about earlier, a large base of companies, obviously kind of in the business and engineering and et cetera, but specifically in healthcare, these large health systems. Pfizer has one of their largest research and development areas here. So a lot in the biosciences, healthcare field is happening right here in St. Louis. Kind of want to quickly give a broad overview for those of you who are joining, who may be sharing this information with future students. We do have direct entry as well as graduate pathways. So we do have a little bit of flexibility with the language requirement, as well as the background GPA. I think one really excellent note for our counselors who have joined today, our MPH program, and similarly with our Masters of Science in Health Data Science, These programs can really take students from a wide variety of disciplines. So they don't need to be coming directly from an MD or a health specific field. We can bring in a diverse population set. Bernie, I think you had mentioned before, we've had students coming from master's in or undergrad in education, and that diversity of the student population really also adds to our program.
Right. And the reason for that is public health needs not just sciencey kinds of people. We do need those. We need the people with the clinical backgrounds, but we need people that have administration skills and passions. We need people who have education skills and passions, policy, research, all those sorts of things. So it's a very multidisciplinary field. So we welcome all backgrounds.
Absolutely. And then last note for our counselors who have joined today, our program does not require GRE or GMAT. So that's an excellent benefit. So we're looking at flexibility, no GRE, no GMAT, multiple backgrounds, as well as the graduate pathway direct entry option for that. The application for our counselors is available on the Global app for both direct entry and pathway, and we are SOFAS free application. So that means via the partner portal, you don't need to worry about doing the SOFAS application, which I believe Bernie right now is about $140 more or less. So that's a nice cost savings. And as well, students are automatically considered for scholarships at the time of admission, both for direct entry as well as pathway. It's really important at this critical juncture for students who are planning on coming in spring to make sure that you're getting through the next steps. So just to kind of quickly review those, and then maybe we'll dive into some questions with Bernie. I will be jumping off, but just a couple important next steps for all of the students is if we need to make sure you get your I-20 so that you can then go get the visa. I know for our students coming from India, visa slots we're hearing are now finally opening up. So I see a lot of students going in the next couple of weeks. So if you're committing to St. Louis University, number one, make sure you pay the deposit. There may be some confusion. In some instances, we told you 200, some 300. You can pay 200, you can pay 300. Either is fine. 200 is all we need. Make sure you get that deposit paid. If you don't know how, let us know, or let your counselor who you're working with know. We'll make sure that that's easy. Typically, it's done on Flywire. So pay the deposit. Make sure you submit your financial docs. The financial documents are what is required from you for us to be able to issue the I-20. We cannot just automatically issue that. That's a government requirement. So deposit, financial docs, then we can send you the I-20 and you can make the visa appointment. The other thing that's really critical at this juncture is making sure that as you're planning to arrive, that you're looking at your housing. We do not, find housing for you if you're planning on living off campus. We do have some resources that we can provide to you, but housing in the spring terms is a little bit more challenging because it starts to fill up very quickly. So start thinking about your housing now. Don't wait to your visa appointment. Don't wait until you know if you have the visa. You can start prospecting different locations, getting an idea of the cost, the application process. It's really critical so that when you arrive, you have a successful start, that you can dive into orientation and really start working with Bernie and the faculty, and you're not worried about as much of your living situation. So start thinking about that today. And then the other thing is arrival. The latest arrival date that's approved is January 17th. Orientation for international students will be on January 12th and 13th. That as mandatory. We do recognize that you will need to buy a plane ticket, so we do have a little bit of flexibility, but you have to arrive no later than the 17th. There will be no late arrivals approved at this point. So I just wanted to make some of those quick notes for the next steps and then open it up for any questions that you all have. I'll hang back for just a couple minutes. If there are any non-program related questions, I can help Bernie with those. Otherwise, Bernie will hang back and any program questions. So if you have questions, pop them in the chat or you can unmute. But before I pop out, Bernie, thank you so much for your time this morning. I know it really is an exceptional experience for our students to be able to meet with the department before they arrive. So we are really grateful.
It's all my pleasure.
Yeah. So any
before the questions start jumping in, I wanted to make just a couple comments about your remarks about next steps for the students starting soon. In terms of the housing, as Ryan mentioned, the on-campus SLU housing is limited. However, there's a ample, affordable, even more affordable, in my opinion, apartments very close to St. Louis U and very close to the College for Public Health. So if you don't have that information, we have a lot of specific apartments and apartment complexes that we can connect you to. Just let me, send me an email and let me know. I can get you that, list of those. The other thing we can do is we can get you into our student Facebook group so that you can talk to current students if you're interested in maybe finding a roommate. We had a huge international student new cohort come in this fall. So we have 31 new international students just this fall in the MPH program. So they could be a great help to you also. So we can get you connected with them. So, yeah.
Yeah, no, a great note. I mean, housing, we're lucky that we're in a city, so there is housing around, but it does fill up quickly. So that is really important. So and then once you have your visa appointment, please let us know. And then once you have your visa, please also let us know. We're keeping a list of those visa secured so that we can best plan for your arrival. All that we do and kind of pushing out this information is to make sure that your start is successful. There are a lot of things that you need to do before you arrive, but it's really important that you get that done because your investment in this program is paramount for us. So we want to make sure that you are successful because your outcomes are our outcomes. We also will be having a series of webinars the week of December 12th, pre-orientation, kind of pre-arrival. So you'll be getting information if you haven't received that. We do highly recommend that you attend. Each day that week, we'll have different sessions for international students. One day will be about kind of housing, insurance, and livability. One day will be more about immigration. So more information to come on that. So if you have questions, feel free to unmute yourself, or if you prefer, just pop it in the chat. I will leave you with Bernie. Bernie, thank you again.
Thank you,
I will
Ryan.
also share this recording with all of our attendees and registrants after. But we can't wait to welcome you to campus. And Bernie, thanks. And feel free to just end the session when you all are wrapped up.
Okay, great. Thanks, Ryan. Okay.
All right, take care. Bye-bye.
Okay. Well, do we have any questions that anybody wants to unmute and ask, or you prefer the chat box, whatever? Don't see anything. What I'm going to do here, bear with me one second.
And Bernie, I'm going to end. So I'm hoping this doesn't end the session for everyone. If the session ends, maybe Bernie, do you want to pop? I have my email, or I had my email up. So I'm going to end.
I think if you just say leave the meeting, you'll be fine.
Okay. I'm just
in the meeting. Yeah. Yeah. Okay. But I just want to let you all know that I just placed a link in the chat box. If what we talked about today is of interest to you and you want to connect more with us tomorrow, Friday, from 11:30 a.m. our time, U.S. Central Time, to 12:30, so it's a 1-hour session. We're going to have we're calling it a MPH, closer look at the MPH program. And so our associate dean is going to be on there, our 2 department chairs, the members of our senior members of our student success team that I just mentioned. So they're all going to be on, and then Dr. Jen Chang, who's the MPH program director, and myself, we're all going to be online for about an hour and each take a turn to talk about, what the program experience is like. So if you'd like to join us tomorrow, you don't have to use that link to register, and we'll see you at 11:30 tomorrow, our U.S. Central Time. Okay. Let's see. Do you have okay, I see a couple questions here. Do you have on-campus placements? That's from Samaya. I'm not sure if I understand that question, Samaya. When you say placements, are you talking about part-time jobs, maybe? If that's the case, while you're a student, that we do, the university does have some. It's limited, obviously. There's 13,000 students at SLU and we can't employ all of them, but there are some good opportunities. And there's a tool on our website called Handshake. So if you go to the St. Louis U website, SLU handshake.edu. And then in the search box, type handshake, all one word. That'll take you to a site, place on the website where they actually have all that, and you can look at that. So yes,